Sir, I request Vasant sir to record this meeting also, sir. Further also, sir. Be as a host, sir, for some time. Thank you.
Yes, sir. Sir, shall I start? Hello.
Yes, sir.
Shall I start?
Yes,
sir?
sir. Yes, sir.
Yes, sir. Good evening to all the members of Vishwa Ayurveda Parishad and today's chief guest, Professor Mahesh Vyas sir. He is my Guruji at Jamnagar, and as well as Dr. Prem Prakash sir. And good evening to all the delegates who have participated in this session. As the topic assigned to me for today's session is how to publish case reports. So in science, the credit goes to the man who convinces the world, not to the man to whom the idea first occurs. As told by the great, the scientist, Sir William Osler, it shows the importance of the publication. The credit goes to that person who publishes the first, his findings, etc. Not the person who invented everything, but he has not published, he is not going to get the credit. So another one famous saying, I am starting with because this shows the importance of the publishing the case reports, or in general all the articles, review or research articles, or even the case, including the case report. So publish or perish, or publish and prosper. With this saying, just I am awakening Ayurvedic fraternity to publish, start publishing the case reports or articles related to the research or review articles. A case report.
Dr. Raju sir, please mute yourself. Dr. Raju Kurane. Dr. Raju Kurane sir, please mute yourself.
Okay, sir.
Yes, sir. Please, sir. Patil, sir.
A case report may be the beginning of a glorious and successful career in medical writing. As even though it is known to be the lowest rank in the pyramid of evidence, while pyramid of evidence highest is the systemic reviews and meta-analysis. And then comes the clinical research, experimental research, and then the case series. At last is the case report, even though it is last in the ranking of the pyramid of evidence, but it is the best beginning to start writing the publication for a medical fraternity. So I'm going to cover the following topics today: introduction, general guidelines for article writing, how to start writing an article, especially case report, then submission checklist, research article, then the case report. So the introduction, as I already told, publish or perish, or publish and prosper, and why you need to publish the articles in general, not only the case report I am telling. The quality publications in Ayurveda are very less. Only one Ayurvedic journal has impact factor in Thomson Reuters, that is JIAM. None of the other, even Ayu journal also not having the impact factor of Thomson Reuters. And practitioners are rarely publishing case reports in the journals which are having a high impact factor. And why to write and publish the articles? A scientific experiment is not complete until the results have been published. Share the research findings that advances the knowledge and understanding of the medical science. To present new results or methods, to rationalize published results, to present a review of field, or to summarize a particular topic. That is review article, it is nothing but. Then top 10 reasons for the manuscripts or the articles rejected by the selection of wrong journal or submission to the wrong journal in wrong format and the wrong way of preparation. disorganized study design, defective tables and figures, poor organization, poor writing and spelling, no hypothesis or problem statement in the introduction part, over interpretation of the results, no or insufficient conclusion, article unfocused and long, inappropriate statistical methods, poorly written abstract. And this in general, this is the process of publications, how it happens. Once the author submits the manuscript, it is going to be received by the editorial staff. Then they'll see whether it is appropriate to the journal or conforms the guidelines. If it is not conforming the guidelines, then it is rejected outward without assigning to the peer reviewers. If it is as per the guidelines of the journal, then it is assigned to the peer reviewers, and it is then going to be a blind review, a double blind review in most of the high impact factor journals following. And editor, then it is after the peer review, it is again sent back to the editor, and he will see all the things whether it is suitable for rejection, means acceptance, rejection or revision. So it can be outrightly rejected, or after revision it can be accepted, or directly it can be accepted. This is in general the process. Then types of medical writing, as you know, editorial, original article, review article, short review, case reports, letter to editor, and book review. Then coming to the today's topic, that is case report, how to write and publish the case report. The case report, what is case report? Basic definition of case report is description and discussion of a clinical case or an anatomical organ or an excised part or an substance which is seems to be a duplicate, or in case of Rasastra, etc. In case of Shilajatu, they are having adulterant, etc. That also you can consider under case report for particularly in these cases, and as well as pharmacovigilance and adulterants or other alternative drugs, cheaper drugs, dubious drugs. They are adding, that is also considered under this case report. Perhaps it is perhaps the easiest type of journal article for clinicians to write, because the writing matter, the stuff is very less, and it is focused to that particular subject.
Last floor.
Then why to publish case reports? It is the first lead for the clinical evidence. Even the practicing physician can also publish it. Doesn't need much skill as like that of the original research article, whether it is experimental or clinical. The different presentation of disease, region-wise, race-wise, will enrich the knowledge of practitioners. The physician will get more popular, and the science as well. Even I evidence this in our journal. Many of the authors, they are publishing case report. One such example is the one case report he has submitted, the MD scholar from Hassan, Huntington's, Korea. Then I got an email from foreign one foreigner. He is asking for email of that author to consult him. Likewise, the patients will contact you. Sir, Sridhar sir.
Double hai na?
Yes, sir.
Sir, please mute. I'm getting the noise.
Now you are the host now, sir. You can only mute, sir. Otherwise, make me host. Sir.
No,
I will
sir.
do that.
Oh. Yeah, you can make me a co-host, no? That is
You can request.
Dr. Deepak Shukla, sir, please mute yourself. Dr. Deepak Shukla ji. Dr. Deepak Shukla ji, please mute your mic,
Yes.
sir. Please mute your your mic. There is a lot of
Okay, sir. Okay.
sir.
Okay. Thank you.
So it will be, the publications will be having a high impact. Your case can improve health outcomes of other practitioners who starts practicing or following your the treatment. potential publication sites, research-oriented journals, general dental journals or specialty or subspecialty journals. And now our Ayurveda case report journal is also there, published by All India Institute of Ayurveda. Exclusively it is on case reports only. Teaching oriented publications, journals, textbooks, etc. and journals specializing in case reports. In medical science, BNJ case report journal is it is the frontline journal among the case report publication. And learning objectives, determine what types of cases are worth reporting and why. And why you have to have an explanation to the editor why your report, case report is unique and special, and it should be considered for the journal. Understand how to structure a case report, learn what audience to reach and what journals to publish, understand the ethics of publishing. Target audience, physicians in active clinical practice, fellows, residents, research assistants, and learners. Background, the background in case report, it is like a storytelling in medicine. It should be clear, short, and useful for its purpose. It should be written in the form of verbal presentation of a case history. Case reports are the lowest rank in the world of evidence-based medicine, as it is cleared in the previous slides. It can be powerful and instructional. Possible reasons for a case report: the very rare disease, association of diseases, rare presentations of more common diseases, outcome of a novel treatment, reporting a particular outcome of a case management, mistakes or complications and lessons learned from that mistakes, a new disease entity, new treatment modality, and the uniqueness of the treatment means by that treatment, if the practitioners or that particular expert has got the results within a short period, and that is called miraculous cure, what you say in the medical, then such case reports can be worth to be published and considered for the publications. Before writing, the author who is going to submit to the journals should first identify the journal, then see the instruction or guidelines for the authors, and not an expert, or read several case reports, search, sort, and summarize. You have to read several case reports before submitting to that, and then search, sort, and summarize your case report also after seeing some sample articles published in journals. Then from framework, outline of the case report, just I'm going to tell in the next slides. And you have to see the care guidelines for case reports. Then case report structure, it should contain abstract or summary, and in that keywords: introduction, the case report, discussion, conclusion, means the lessons learned from the case presentation, and references, acknowledgement. So the abstract, brief summary, not required by all journals, but still, if you are written abstract, not structured, it should be a non-structured. It will quickly scan the content of the paper. Then if it is interesting, the reader will go through the full details of the article. Word limits will be different for different journals. Usually 250 words are allowed. Introduction, background information, and why the case is being reported. The uniqueness of the case should be written in this part, so that editor will consider it for the review. It is the brief overview of the problem or diseases or treatment, etc. It includes citations from literature and closing sentence about the case. It may be the prevalence or incidence of that particular case, or the treatment available, currently available treatment and its lacunas, and what the gap can be filled by the novel treatment which you are reporting in this particular case. That can also be written in this part. It gives the justification of why the case is worthy of reporting. So it is the most important. The last paragraph of your introduction should be why you are publishing this case report. What is the uniqueness of your case? You have to mention whether it is a new disease or the different presentation of the disease, or the diagnosis, or the different etiological factors, or the uniqueness, new treatment modality, or the results are you have found very in a short period. You can mention all those things in that last paragraph of introduction part. Then the actual case report, what are the points to be included? In the history, presenting features, past medical history, social and family history, drug history in the sense treatment history, all these things to be noted. Then physical examination, investigations, differential diagnosis, treatment and outcome, that is the results of that particular case. Then what are the essential things? Anonymize the patient as much as possible. Means all the privacy related to the patient should be kept secret. It should be removed, and it should not be entered anywhere in the article. Even in the film, X-ray film or ESG film or CT scan film, all the patient's detail should be removed. The place name, even the hospital name also should be removed as per the ethical standards of publications. Avoid names and initials. Omit non-essential personal details. Only essential means the sex and age is important. That's all. Table of results can be helpful. Photos of clinical science and diagnostic studies are priceless, means highly valuable. Photos published after taking the written consent and masking the identity by blackening that particular means if you are displaying the face, eyes should be masked with black paint. Discussion part, it should clarify key issues. You can refer other cases in the literature which are published earlier to this, the past literature, already published case, and how it is different from that. Or if it is similar, if then your treatment is different, that also you can discuss. Or the shortfalls or the mistakes of the previously published case report also you can comment here in a short way, not in the detailed way. A short review of the literature is appropriate. In the sense, Ayurvedic usually we have to devise a particular samprapti for that particular case, not which is told in the Shastra. That given case, you have to devise the samprapti chart in the present in the form of chart. You can write and then include the methodology used for literature search and brief discussion of the interventions used, means treatment modalities, the medicines, and if you are using any proprietary medicines, you have to mention the company, the brand name and the company name, dose, everything, dose, duration, anupana, all these things should be mentioned in the interventions, and samprapti vigatana in briefly in the form of chart and as well as probable mode of action. This also, it should not be general, it should be unique to that case, particular case. Then message or the lessons learned from this case report, you have to highlight at the end in the form of conclusion. Then get help, second opinion or third opinion from other your colleagues or the experts in that area. You can consult and get the second opinion or the third opinion also even. while considering for the diagnosis as well as the treatment modalities and the justification for that particular treatment, why you selected it, and how it is helpful in breaking the sampraphya of that particular case. That is also very important. And get others not involved in the management of the case to proofread the article. Why? Because it becomes impartial if it is he is not involved in that particular management. Then consider their comments carefully. And ethics of publishing a case report. The first and foremost thing is the consent, informed consent, and consider privacy laws. It may be different for the different countries. Duty of confidentiality persists even if the patient has died. Deliver a copy of published paper to the patient or relative. A corollary to an individual's copyright, which requires informed consent before publication, is the need for preserving confidentiality. Individual autonomy determines to whom matters of personal nature and health is a most intimate one are disclosed. Access to the medical literature is unrestricted, especially in the electronic age. So one should be very careful. Then personal identifiers must be stricken from any case report with particular care taken when ancillary data is presented. That is an imaging study, means supporting evidences. If you are submitting, you should be very careful to remove all the details which identifies the subject or patient, which may be inadvertently contain traceable information of that particular subject. That is, for example, a hospital or a Medicare number, the IPD or OPD number, or the case record number or registration number, birth date, initials, or the name. A reasonable approach may be to designate a member of the research ethics board to review case reports written by members of an institution to ensure that consent and confidentiality issues are respected. This seal of approval could be used to ensure ethical conduct at the time of submission of a case report to a particular journal for publication. The manuscript should not be submitted to more than one journal for simultaneous consideration. The submitted work should be original and should not have been published elsewhere in any form or any language unless the new work concerns or expansion of previous work. There should be some new addition to the previous publication, then it becomes unique. A single study should not be split up into several parts to increase the quantity of submission, to increase the number of submissions and submitted to different journals or more than one journal. Results should be presented clearly, honestly, and without fabrication, falsification, or inappropriate data manipulation, including image-based manipulation. Authors should adhere to the discipline-specific rules for acquiring, selecting, and processing data. No data, text, theories by others are presented as if they were the author's own. Means copying the other's materials without due acknowledgement, that is called plagiarism. Then it is a wrong way of practicing or publishing the matter. This ethical considerations has been taken from the Springer article published in the springer.com. And the informed consent form Springer nature, it should be like this. I give my consent for information about myself or my child, my relative, to be published in so-and-so journal, manuscript number, corresponding author. In cases where the patient has died or is incapable of giving consent, consent may be given by the next of kin. If the patient is under the age of 16, consent should be given by a parent or guardian. Then he must say, I understand that the text or any pictures or videos published in this article will be used only in educational publications intended for professionals.
Madam, I request Dr. Vijayalakshmi Madam to mute her mic. Dr. Vijayalakshmi Ma'am, please mute your mic.
నమస్కారం పొద్దున లేపితే నమస్కారం పెడతా, లేకపోతే ఇదే చివరి నమస్కారం అని అమ్మవారికి దండం పెట్టిస్తే గొడవ వదిలిపోతుంది. ప్రశాంతంగా ఉంటాడు మనిషి. ఆ మృత్యువును గుర్తు చేసుకుంటే నీతిగా ఉంటాడు.
Yes.
Article submission. After having all the consents and the matter ready to publish, follow all the instructions and guidelines of the journal webpage and write and include a cover letter to the editor. And this will, your publication is ready to submit to the journal now. These are all the essential things to be prepared before submitting to the journal. Then coming to the specific, how to write different areas, means clinical cases of different speciality. Just I am going to say a few important things regarding this. Clinical case reporting, symptoms can be portrayed in tabular form with chronicity in the order of manifestation. For assessment, use standard internationally accepted scales, for example, psoriasis, PASI scale. Use before treatment and follow-up images, and as well as the laboratory parameters, that is profile. In case of example, COVID profile before treatment, and the follow-up 81, 82, 83, like after treatment 1, like that you can mention. Do not use images of report. Actual report one should not submit to the journal. That can be sent if the editor asked for the genuinity, then you can send. Otherwise the images is enough. The images only images are used for publications, not the report. Use the only images of film, ECG graph or EEG graph, etc. Mask all details related to the patient's privacy. So in the steroid phases, moon phase, you have to highlight like this. And the steroid dependent phase, if the it is localized to below eyes, you can show that particular part of that face itself. This will minimizes the disclosure of the privacy of the patient. As far as maximum, you have to maintain the privacy of patient. Only show the lesion where it is affected lesion only. Then anatomy, when you are submitting the case report regarding the anatomical variations in cadaver, the image of the organ in situ with label you have to take. Then image of the organ in ex situ you have to take. Then weight of that particular part. Then dimensions, means length, breadth and height. Relations with surrounding structure, anatomical relations, means medial, laterals, anterior, posterior, then superior, inferior, like this relations you have to mention. Then details of the variations you have to mention. This is the sciatic nerve. It has bifurcated in the thigh region. In surgery, while reporting the surgical cases, define the dimensions of the surgically excised part or organ or pathological entity. Pathological entity means renal stone or gallbladder stone. You have to mention the nature of the gallbladder stone, whether it is spiky, sharp or rounded, or like this size, shape. All these dimensions one should mention. And details of the procedure used. In case of fistula, you have to write the complete procedure, how you have done. In photography, even you can give the video. Some journals publish the video also. In case of fistula, mention the name of the thread and drugs used, including the preparation date, batch, company, preserving method, everything. For assessment, use the image of specific part. For example, fistula perineal region, you have to mention weekly assessment. Weekly, if you are changing the thread, you have to take the image weekly, and as well as the mention the cutting rate by measuring the length of thread. It is presented in the form of graph, how the length of the fistula is coming down by measuring the length of the thread. And the Shalakya This article has been taken from the All India Institute of Ayurveda Case Report Journal. See here the details of the procedure you have to mention, like this intervention you have to mention. See the procedure name, medicines used, duration and posology is mentioned in tabular form. This will minimize the time for the reader. He can easily understand. Then complete details of the medicines also to be mentioned. Then the observations how they are means the HbA1c in diabetic retinopathy case it is. They have mentioned the graph before and after treatment like this, and as well as fundoscopy you can see the follow-up visits before treatment and follow-up visits they have mentioned very nicely. Then Panchkarma, you can see the one of the article. This is the management of cerebrovascular accident through Ayurveda. Again, it is the Journal of Ayurveda case reports of AIA. So you can see Ksharabasti schedule, how they are mentioned, the Panchkarma, the retention time they are mentioned, and the Samyak Nirodha Lakshanas, and the assessment scale, National Institute of NIH stroke scale, internationally accepted scale it is. Like this, one should use the accepted scales. Then sample articles, I'm just mentioning the JAHM journal, that is our Journal of Ayurveda and Holistic. The dengue fever, in this platelet count effect of the papaya leaf juice on platelet count. Then lung variation, again in the same journal, abnormal development. You are seeing here the right lung completely, it has means there is no left lung, it is partly means membranous structure, as you are seeing on the right side in figure 2. Left lung is only a membrane like structure, the whole of the rest is right lung. This is the abnormal case reporting done by the author Amol Deshpande. Then role of KSHARAKARMA in recurrent cervical erosion, a case study. They are mentioned like this assessment means from day 1, day 7th day, starting from the 7th day to 60th day, they are mentioned like this assessment. And then the figure 1 before treatment, then figure 2, and the third one, like this they are mentioned. And then Ksharasutra ligation treatment for Arsha. So like this, you have to take the picture. Then congenital block vertebrae, C2 and C3 are here combined congenitally. So this reporting has been done in pulsus.com, Pulsus journal. This is exclusively case report on anatomy, pulsus.com. Then coming to the conclusion, it is the first lead for the clinical evidence and the first opportunity for a practitioner to publish his case report. And by publishing case reports, the physician will get more popular and the science will also become flourished. And your case can improve health outcomes of other practitioners. It will be helpful to follow, and it gives lead for the development of drug also, as it is the initial step. From the case report, one can devise the case series and pilot studies and subsequently the clinical trials. One should first take the consent from the patient, select appropriate journal which suits to your case study, then read complete guidelines before preparation and know the publication ethics before submitting the case report. And at last I say, publish and prosper. With these words, I'm very much thankful to the organizers and as well as the participants who have participated in this session. Thank you one and all.
Thank you, Dr. Vasant sir, for giving us a detailed picture of why to publish and how to publish with published articles and examples also. So I request the participants